my name's Taylor Schlofer.
I'm Katie Dietrich.
I'm Ashley Jennings.
I'm Amanda Thorpe.
And I'm Chelsea Bickerstaff.
And this is our presentation for Nursing 332 Research 2. Our group did the correlation between shift length and nursing error. We reviewed 5 studies to evaluate the significance of the problem and the physiological strain among staff, as well as offer recommendations that can be used in nursing practice. High demands and an increased workload on nurses increases the risk for nursing errors. Nurses are also required to work extensive hours, which also increases the risk for nursing errors. Nurses need to understand the physiological, psychological, and environmental stressors that can increase the risk for nursing error.
As far as the significance of the problem goes, working extended hours in the field is directly related to the fatigue and deprived sleep patterns nurses experience, and ultimately decreases the recovery time needed to provide quality of care. Adverse effects can occur from these situations, which include a decreased reaction time to significant health status changes seen in patients, and as well as increased medication errors, which directly affect the patient and their well-being.
For the process of literature, we use the database SAGE, CINAHL, Wiley, ScienceDirect, and OVID, and the keywords were used: nursing errors, nursing research, fatigue, overtime, shift length, and evidence-based practice. We then narrowed our search by making sure the articles were recent within the past 5 years, that they were peer-reviewed, and that at least one nurse was an author.
Some recommendations for practice would be to allow nurses who work 5 8-hour shifts to leave in a more timely manner to make sure that they're not getting overtime by staying late. Nurses should be able to take more breaks. This would improve alertness and functioning. The nurse manager should be the one who is scheduling these breaks and making sure that they're efficient, making sure that nurses are actually able to eat on their break and actually take a break instead of charting the whole time. Fatigue risk management software has been used to create efficient work schedules, and this should be utilized in the nursing profession to make healthy schedules for nurses. Nurse managers should promote the 5 rights of medication administration to decrease medication errors. These are the right patient, right medication, right dose, right time, and right route. And finally, they should limit overtime for nurses and make sure that they're having at least 1 day off before they're starting a new shift.
Overall, nurses who worked at night were more fatigued than nurses who worked during the day. 12-hour shifts promote physiological strain because of the high workloads, which lead to impaired patient care. There was a direct correlation between the length of the shift and the amount of fatigue they experienced. It was also linked to cognitive impairments and adverse errors and events. Adverse work schedules, long hours, and lack of time off of work were associated with increased patient mortality rates. 12-hour shifts, overtime, nursing fatigue, and nursing errors are all directly related.
So that is our presentation on the correlation between shift length and nursing error. Thank you for listening.